Good morning, everyone, to the Monday, November 29th media briefing with the Windsor-Essex County Health Unit. We will get started right away with media questions, and today we're starting with AM800.
Good morning, Nicole. Just wondering if there is an update in regards to the vaccine rollout for the age 5 to 11.
Yeah, I can give a bit of an update. So I think when we last met, we were just getting ready to start welcoming youth or children 5 to 11 for vaccination starting on Thursday the 25th. I don't have a total number, but I can speak approximately how many children or youth we've seen come through our mass vaccination site at Devonshire, which we know is one of the key places for vaccination. So approximately between Thursday and Sunday, we've had about a little over 3,000 children between the ages of 5 to 11 receive their first dose. So we think that's great and really encouraging for the first few days of our rollout, and hope to see more certainly as we continue, knowing that our grand total of children is approximately 33,000 for our region.
I checked out the website late last week, and obviously there was some days that were fully booked, and then some days near, I guess it's a 5-day time frame near the end where there were still dates available. But how is the booking going? Are you pleased with, I guess, this coming week?
Yeah, we do have some projections. So we have definitely more capacity than as you pointed out, I think we have more capacity than we have bookings. So individuals should just know that they should be able to get in a really timely way. I think probably for this age group, it requires a lot of planning on the part of parents. So I suspect that maybe why you're seeing less on some days, or some conversation and planning related to making sure that everybody's ready. But yeah, I think we're so encouraged to see our bookings, and just a reminder that anyone who hasn't received their first or second dose that's 12 plus yet can still come in, and we are still accepting them as walk-ins.
And then I noticed a tweet from a local doctor. So there's still some pharmacies and local physicians that are administering the vaccine, obviously to individuals 12 plus, but then that 5 to 11 category as well. So if I guess parents don't book at the mass vaccination site, they can still go to, I guess, others that are offering it.
Yeah, absolutely. So every avenue that we've had for vaccination is part of the 5 to 11 rollout as well. So we will have clinics, mobile clinics, and 5 to 11 vaccinations will be part of that. We may have some that are more tailored to that age group in the next month or so. So expect you will see that as well. We know many would prefer, certainly when it comes to their children, to take them to their family physician. So there are some family physicians that are already enrolled and vaccinating for 5 to 11, and hopefully more will come on board. And we encourage families to talk to a family physician about their preferences for vaccination. And then, as you stated, pharmacies certainly are still a big part of our vaccination plan, and pharmacies across our region. There's quite a few across our region, which certainly makes it more accessible and convenient.
Thank you.
Any questions from CTV?
Yes, good morning. Are you concerned about this new Omicron variant? And now that it's in Ontario, is it only a matter of time before it reaches Windsor?
Well, we're always concerned about new variants, and we remain concerned about COVID overall. We live in a global society, so it's likely that there's always a risk that variants will spread from one part of the world to the other. It's not entirely we would expect that as we progress through the pandemics, there'll be this variant and other new variants that may come to the forefront. The public health messaging is the same, though, which is that to prevent the spread of any respiratory disease, including the Omicron variant, is to wear a mask indoors, wear a mask when you can't remain consistently 2 meters away from somebody else, to wash your hands, to stay home if you're sick, minimize your human-to-human interactions. I think those measures will still need to be advanced. I also think that people need to continue with. We need to, as a society, as a culture, continue with our vaccination efforts moving forward. I think we don't have a great. We're in the early understanding of this new variant, so it's difficult to comment on exactly what the public health implications would be specifically. How much more infectious is this than the current variants? I think that answer is still to be determined. We're always concerned about strains of COVID that might be resistant to the current vaccination program, but that too remains to be determined. So at this point, I think it's continue with the same public health measures we've advocated for previously and to monitor the situation carefully. Ontario is screening all of its positive tests for the new variants as well. So I think we have a reasonable approach moving forward.
Okay, thank you. And what are therapeutics? Some protesters were touting this as an alternative to vaccines.
It's hard to know what these individuals are alluding to. Whenever people get sick, there's a whole spectrum of treatments you can offer people, including supportive treatments. But I think that at the end of the day, the best way to deal with COVID at this point is to get vaccinated. We've had deaths among people that are at the twilight of their life, but we've also dealt with deaths of people who are living in the community, men and women in their 50s and 60s who have lived in the community. And I would urge everyone who's not vaccinated but eligible for vaccine to get vaccinated. If you get vaccinated, you're less likely to get infected with COVID. You're less likely to transmit COVID to other people. You're less likely to be hospitalized with COVID. And you're less likely to die of COVID. And I would say that if you can't get the vaccine for yourself this year, do it for your family, do it for your kids, do it for your husband, your wife, your mom and dad. But if we really want to try to effectuate control, vaccine is one of the most important things that we can do moving forward.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Are we still looking at a backlog of test results when it comes to variants of concerns in Ontario, and any update there?
Well, maybe you could talk about the operational items and I can talk maybe about the clinical issues.
So there isn't really a backlog of testing for variants. There is always a delay, if that's what you're speaking to, but there isn't per se a backlog that I'm aware of.
My apologies. So for the delay, or do you know how long that delay is, or could you just go over that again for me, please?
Usually it takes a few days. Sometimes it's quicker, but in general, we were seeing that it would take a few days at the most.
Yeah, so, there are two separate issues. One is what is the best public health management? And we know that if you have COVID, a test positive today, the vast majority of those cases are Delta variants. So we treat them as if they're Delta variants. And the fact that we have confirmation of what variant it is at some point after the positive test doesn't really change our clinical management for the individual or for the population overall. So in this particular case, I wouldn't characterize it as anything particularly adverse. I think the more important public health goal now is to screen for other variants, which is the Omicron variant. That's, I think, one of the goals we have to work towards. But I think anytime we do testing, it's always to think of what's the context in testing, and knowing that you have Delta today versus knowing that you have Delta a few days from now doesn't really change our public health management.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. Are we in a fifth wave, or did the fourth wave ever end?
Yeah, you know, I'm always a little I know we use the term waves. In retrospect, you can look at when there are peaks and valleys and then make a surmise that this was a wave or this was not a wave. So as a pure epidemiological construct, I'm not sure we should use the term wave. Nevertheless, it's used in, it's commonly used. I think at this point, what we do know is that we have an increasing burden of disease. I think today's data over the weekend, I think if you send us an email, we'll give you the exact number. I think we had 86 cases on Saturday, and the last time we had 86 cases was on or about September 3rd. So we have an uptick in the disease activity in the health district, and we have an uptick in disease activity across the province, and that's the real concern. The reason we're concerned about disease activity in cases is that the more number of cases there are in the community, the more number of people, the greater the risk of people going to the hospital, getting sick and dying, and the greater the number of cases in the community overall, the greater the likelihood that there'll be cases in schools and in nursing homes and retirement homes where it might reach vulnerable people. So I think that to me is the best probably characterization. I think, you know, at some point in time, people may comment on a fourth wave versus a fifth wave, but I'm not sure we have enough to make that determination today.
Thank you.
Any additional questions from AM800?
Yes, just a couple more. Nicole, sorry, going back to the vaccinations for 5 to 11, you said roughly 3,000. Is that just at the mass vaccination clinics, or that includes the physicians and pharmacies?
No, it just is the mass vaccination, Rob. We can see if we can pull a more accurate number of the total across all, across all sites, and we can have our communications team share that with the media later.
And one final one, just in regards to the school outbreaks, I'm not sure if this was discussed last week, I was off, but is there any updates in regards to St. Gabe's and St. Joe's and River Canard?
So we don't have an update at this point in time. Obviously, this is just an outbreak we continue to monitor, and it's Monday morning, so it's always a challenge for us to give any significant updates, because we're still assessing everything that happened over the weekend.
But those two schools remain closed, right?
Yeah.
Okay, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Hey, thank you, everyone. We'll see you again on Wednesday, December 1st. Have a great day.
All the best.